Hello, I'm Dr. David Thompson, and for 30 years, I've seen things in medicine that would break your heart. But I've also seen miracles, natural, simple miracles that most doctors, frankly, are too busy or too focused on pharmaceuticals to notice. I want to tell you about Eleanor Vance, a bright-eyed woman from Seattle. She was only 68, but her life was, in her words, a prison. She had been an active teacher, but years of chronic back pain and a severe loss of leg muscle mass, a condition called sarcopenia, meant she could barely get out of her armchair. Her legs would shake just walking from the kitchen to the living room. Her children, out of love and necessity, were preparing to move her into an assisted living facility. They were looking at nursing homes, and Eleanor was, understandably, terrified. The fear wasn't death, it was dependency. The fear of losing her dignity, her autonomy, and becoming another patient on a cocktail of pills. I looked at her chart, saw the muscle wasting, the inflammation markers, and I told her family, "We're not going to a nursing home. We're going to the park." 3 months later, Eleanor wasn't just walking, she was taking gentle hikes. 6 months later, she was independent, strong, and walking without a cane. She is 70 now and just completed her first 5K walk. A true, vibrant, independent woman again. The incredible truth? It wasn't a new drug. It wasn't an expensive surgery. The solution was a simple, sequential, natural method that 97% of doctors usually overlook. It's not about expensive supplements or complex diets. It's about targeting the neuromuscular junction and cellular inflammation with a specific, scientifically proven set of movements. I call them the 7 pillars of leg strength. They are 7 exercises that you can do in your own home that will help you walk strong again. I promise you, this video will guide you through the detailed, step-by-step implementation of this exact method. Stick with me, and let's reclaim your strength together. Now, let's get specific. I want to know who is in the room with me. If you are watching this, you're concerned about your body's health, and that makes you proactive. Right now, in the comments below, I want you to tell me your biggest leg symptom. Is it difficulty climbing stairs? Is it fear of falling? Is it thigh weakness after sitting? Just tell me the symptom you notice the most. This helps me understand our community better. For those of you feeling this weakness, whether you're over 50, you spend all day sitting at a desk, or you're a postpartum woman whose core and stability are compromised, I need you to internalize this. Your declining strength is not an inevitable sentence of age or genetics. It is most often the result of 2 deficiencies: a deficiency in controlled, progressive muscle loading, and a resulting deficiency in the necessary cellular signaling that repairs muscle tissue and strengthens nerves. Your muscles don't listen to your brain because the communication line, the nerves, has become congested by chronic low-grade inflammation. The exercises I will show you are the natural way to clear that congestion. For those of you just joining, my name is Dr. David Thompson. I have spent the last 3 decades in clinical practice, treating thousands of patients just like Eleanor, people who were told their decline was irreversible. This channel is my mission. My goal is to help you live a life of healthy, vibrant independence, not just longevity, but independence, primarily through scientific, evidence-based practices focused on what your body is truly capable of. We believe that the best pharmacy is often the one you already own, your own body, given the right inputs. We focus on the science, what is happening at the cellular level. I've seen the power of targeted, natural interventions, whether it's with nutrition or movement, to reverse conditions that big pharma claims only drugs can manage. If you value your freedom and independence, you are in the right place. Before we dive into the solutions, let's confirm the diagnosis. We need to know if your legs are showing the classic warning signs of sarcopenia and functional decline. This isn't just about looking fit, it's about neurological and cellular health. I'm going to give you 5 specific, common, everyday symptoms. Count how many of these apply to you. 1. The stuck symptom. Do you need to use your hands to push off your knees or the armrests when getting up from a chair? 2. The trip symptom. Do you trip or catch your toe on flat surfaces or rugs more than once a month? 3. The luggage symptom. Do you find lifting a standard 10-pound bag of groceries noticeably more difficult than a year ago? 4. The slope symptom. Do you avoid walking up gentle inclines or ramps because your calves feel strained or tired quickly? 5. The wobble symptom. Can you stand on one leg, unsupported, hands on hips, for less than 10 seconds? Try it now. Now, quickly, look at your hand and count the number. Comment your number below, from 0 to 5. Be honest. If your number is 3 or higher, your leg strength is compromised, and your risk of a serious fall is significantly elevated. This is your urgent wake-up call.
Why?
The root cause linking these symptoms is not simple wear and tear. It is a cycle of chronic inflammation, oxidative stress, and neuromuscular disruption. Imagine your muscles like a powerful engine. When you don't use it, it doesn't just rust, the signaling wires become faulty. Chronic low-level inflammation, often from sitting too much, poor diet, and lack of use, causes oxidative stress. This stress damages the mitochondria, your cell's power plants, and, crucially, the neuromuscular junction, the precise communication point where your nerve tells the muscle to fire. When this communication is disrupted, your brain thinks it's firing a strong signal, but the muscle only responds weakly. We are not just building muscle mass. We are restoring the powerful, clear, high-speed neural connection. The solution is not complex. It's about consistency and progression. These 7 exercises are designed to work together to address the root cause by boosting muscle strength, improving balance, and enhancing the brain-to-muscle connection. Solution 1. The pillar chair squats. This is the king of functional exercises. It directly rebuilds the power needed to stand, walk, and recover from a stumble. It targets the largest muscle groups, the glutes, the hamstrings, and the quadriceps. Mr. Thomas Reed, 72, from Arizona. Thomas suffered from a debilitating knee injury that left him with a severe limp and fear of falling. Doctors wanted to push an early knee replacement. Instead, we focused on this move. In the first 2 weeks, his confidence was the first thing to improve. After 6 weeks, he could get up from his favorite low-seated sofa without struggle, and his orthopedic surgeon noted a 15% measurable improvement in the surrounding muscle strength, effectively delaying any thought of surgery. The chair squat is a compound movement that forces multiple large joints to work in concert. This coordinated, heavy loading signals to the brain that the muscle is needed. This signal upregulates the release of powerful anabolic hormones, like insulin-like growth factor 1, IGF-1, which not only promotes muscle protein synthesis but also acts as a neurotrophic factor, essentially feeding and strengthening the nerve cells that connect to the muscle. This is the ultimate communication restorer. A study published in the Journal of Gerontology in 2018 demonstrated that simple bodyweight resistance training, like chair stands, significantly improved functional lower body strength and reduced the risk of falls by 20% in an elderly population compared to a control group engaging in non-resistance activities. Practical guide: how to. The setup: use a sturdy chair. Stand directly in front of it, feet shoulder-width apart. The movement: slow and controlled. Push your hips back as if you are reaching for the seat. The downward movement should take 3 to 4 seconds. Do not plop down. Tap the chair lightly and then drive back up, squeezing your glutes at the top. Dosage: start with 3 sets of 8 repetitions. Take a 60-second rest between sets. Progression: when 3 sets of 12 are easy, hold a light object, like a full water bottle, close to your chest for added resistance. Have you ever done a squat thinking about the neural benefit, not just the muscle? Tell me your current squat number, how many you can do safely, in the comments. Solution 2. The stabilizer single leg stands. This is where we train the small, critical stabilizing muscles, the ones that stop you from rolling an ankle or falling over. We are training the body's natural, internal gyroscope. Mrs. Olivia Chen, 55, an office manager. Olivia sat for 10 to 12 hours a day, and her primary complaint was a chronic low-level ache in her hips and a feeling of unsteadiness when walking on uneven ground. After incorporating the single-leg stand daily for just 4 weeks, her hip pain vanished. The reason? We strengthened the gluteus medius, the side hip muscle, which stabilizes the pelvis and relieves pressure on the lower back and knee joints. This exercise is purely proprioception training. Proprioception is your body's sixth sense, the awareness of where your limbs are in space. By standing on one leg, you force the tiny muscle fibers around the ankle, knee, and hip to constantly make micro-adjustments. This creates new, stronger neural pathways in the brain and spinal cord, rapidly improving reaction time. Think of it as defogging the sensory wires from your feet to your brain. A report in the New England Journal of Medicine in 2021 highlighted that the inability to stand on one leg for 10 seconds was highly predictive of all-cause mortality in middle-aged and older adults. The implication is clear. Stability is a fundamental indicator of systemic health. Practical guide: how to. The setup: stand near a counter or wall for safety, but try not to hold it. Shift your weight onto one leg. The movement: lift the opposite foot slightly off the floor. Keep your back straight, eyes forward. Do not let the hip on the lifted side drop, no hip hike. Dosage: aim for 3 sets of 30 seconds on each leg. If you can't do 30 seconds, do 5 seconds, rest, and repeat until you hit the total time. Progression: close your eyes only when you are perfectly stable with eyes open. Closing your eyes removes visual input, forcing your proprioceptive system to work harder. Try it right now. How many seconds did you last on your weakest leg? Drop the number in the comments. Solution 3. The Accelerator, calf raises. Your calves are often overlooked, but they are the literal springs that propel you forward and prevent the classic shuffling gait. Strong calves protect your shins and stabilize your ankles. Mr. Jeremy Bell, 62, a retired mechanic. Jeremy's main fear was falling when walking his dog in the park. His feet were constantly sore. Calf raises were his miracle. After 1 month of consistent work, he noticed he could walk for over an hour without his feet tiring, and his gait felt lighter and more youthful. The calf raise targets the gastrocnemius and soleus muscles. The soleus, in particular, is a venous return muscle. It acts as a second heart in your lower leg, pumping blood back up to your core. Strengthening it improves circulation, reduces ankle swelling, and, critically, ensures that fresh, oxygenated blood and the necessary nutrients can reach the nerve endings in the foot and lower leg, directly combating ischemia, lack of blood flow. Research from the American Heart Association in 2017 demonstrated a strong correlation between soleus muscle strength and improved peripheral circulation, showing its importance in overall cardiovascular and tissue health, especially in sedentary individuals. Practical guide: how to. The setup: stand next to a wall or counter. The movement: slowly rise up onto the balls of your feet, counting 2 seconds up. Pause briefly at the top, and then slowly lower back down, counting 4 seconds down. The slow, controlled descent is crucial for building the most resilient muscle fiber. Dosage: 3 sets of 15 repetitions. Progression: perform the movement on a step, with the balls of your feet on the edge, to allow the heels to drop slightly below the step for a fuller stretch and contraction. Solution 4. The Protector, glute bridges. This exercise is the best friend of office workers and postpartum women. It turns on your glutes, which often go dormant from prolonged sitting. Strong glutes protect your lower back and stabilize your entire hip complex. Ms. Sarah Lee, 35, 2 years postpartum. Sarah had chronic lower back pain and felt unstable when carrying her child. Glute bridges were the key. Within 10 days, her lower back pain was significantly reduced, and within 8 weeks, she reported a feeling of having a stable base, allowing her to return to her pre-pregnancy energy levels. Glute bridges specifically target the gluteus maximus, the largest muscle in the body. When the glutes are weak, the smaller muscles in the lower back, erector spinae, and hamstrings take over, leading to overuse injuries and pain. The bridge reestablishes the correct firing pattern, teaching the glutes to contract first and strongest. This movement corrects the pelvic tilt caused by sitting, alleviating strain on the vertebral discs. A systematic review published in the Journal of Back and Musculoskeletal Rehabilitation in 2019 confirmed that gluteal strengthening exercises are highly effective in reducing chronic nonspecific lower back pain. Practical guide: how to. The setup: lie on your back, knees bent, feet flat on the floor, about hip-width apart. Arms at your side. The movement: squeeze your glutes tightly and lift your hips toward the ceiling until your body forms a straight line from your shoulders to your knees. Hold the top contraction for 3 seconds. Slowly lower down. Avoid arching your lower back. Dosage: 3 sets of 15 to 20 repetitions. Progression: once comfortable, perform the bridge with one leg extended straight, single leg glute bridge, to double the load on the working side. Solution 5. The Walker Heel-to-Toe Walk. This is a simple, yet highly effective, neurological drill to improve gait and prevent tripping. It dramatically improves dynamic balance. Mrs. Eleanor Vance, our opening story. This was one of the core exercises in her initial protocol. It was the exercise that most directly translated to her ability to walk confidently on uneven pavement and avoid falls. After 1 month of practicing this for 5 minutes every morning, her wobble disappeared. The heel-to-toe walk forces you to narrow your base of support, which challenges the vestibular system, inner ear balance, and the cerebellum, the part of the brain that coordinates movement and posture. It's a form of dynamic challenge that trains the small muscles of the feet and ankles to react instantly, improving the speed of their neural response. Studies on balance and fall prevention consistently use the tandem, heel-to-toe, walk as a key metric. A paper in Gait and Posture in 2016 demonstrated that improving performance on this test correlates strongly with a reduced likelihood of falls, especially in community-dwelling older adults. Practical guide: how to. The setup: find a long, clear path in your home. A hallway is perfect. The movement: place the heel of the leading foot directly in front of the toes of the trailing foot, so they are touching, walking on a tightrope. Look forward, not down at your feet. Take 10 steps forward, and then turn and repeat. Dosage: perform this for 5 minutes daily. Progression: once you can do it comfortably, place a book on your head to force you to maintain a perfectly upright and stable posture. Solution 6. The Climber Step UPS. The step-up simulates climbing stairs, one of the most functionally demanding activities. It builds single-leg strength and stamina, which is essential for true independence. Ms. Maria Perez, 48, a highly successful attorney. Maria noticed she was winded after just 2 flights of stairs. After adding Step UPS to her routine for 8 weeks, she could climb 5 flights without stopping, noting not only leg strength but also a significant improvement in her perceived energy levels. The step-up is a pure test of concentric strength and endurance. It directly targets the quads and glutes, but more importantly, it trains the body's aerobic capacity within the muscle tissue itself. Consistent Step UPS force the muscle cells to grow more capillaries, tiny blood vessels, and more efficient mitochondria. This is like upgrading the fuel line and the engine itself for better, longer-lasting energy. The simple step-up test is a standard in cardiac and physical therapy assessment. Research in the European Journal of Applied Physiology in 2020 showed that step training significantly increased leg muscle power output, which is the most critical factor in avoiding a fall once you've stumbled. Practical guide: how to. The setup: use the bottom step of a staircase or a sturdy, low box. Start low, about 6 inches. The movement: place one foot completely on the step. Push straight up through that heel until your leg is straight. Bring the other foot up, then step back down slowly. Keep the movement focused on the leg that is on the step. Dosage: 3 sets of 10 to 12 repetitions on each leg. Progression: gradually increase the height of the step, or hold light dumbbells at your sides. Solution 7. The flexibility key: hamstring stretches. Strength without flexibility is a recipe for injury. Tight hamstrings pull on your pelvis, leading to poor posture, back pain, and restricted walking ability. This stretch is the key to unlocking your full gait potential. Mr. Peter Davies, 75, former golfer. Peter's biggest issue was his short, choppy stride. Tight hamstrings were the culprit. By holding a simple seated hamstring stretch for 60 seconds twice a day for a month, his walking stride length increased by a measurable 10 inches, instantly making his walking more efficient and less tiring. Tight hamstrings inhibit the proper firing of the glutes. By gently and consistently stretching, we are not just lengthening muscle fibers, we are calming the muscle spindle, which is the sensor inside the muscle that measures the speed and extent of stretch. We are reprogramming the body's guard reflex to allow for a safer, greater range of motion, which is crucial for a strong, long stride. The importance of flexibility is highlighted by studies like one in the Journal of Orthopedic and Sports Physical Therapy, 2015, which linked reduced hamstring flexibility to an increased risk of lower back injury and postural dysfunction. Practical guide: how to. The setup: sit on the edge of a chair, one leg extended straight out with your heel on the floor, toes pointing up. The movement: keeping your back straight, gently lean forward until you feel a comfortable stretch in the back of your thigh. Do not bounce. Dosage: hold for 30 to 60 seconds on each leg. Repeat this twice per leg, once a day. Note: never stretch into pain. A gentle, tolerable tension is all you need. Have you ever prioritized stretching after strength? It's a game changer. Let me know if you feel a difference. We have covered the 7 pillars of leg strength: the chair squat, single leg stand, calf raise, glute bridge, heel-to-toe walk, step up, and the hamstring stretch. These are not 7 random exercises. They are a sequential, scientifically backed protocol designed to fight the root cause of weak legs, neural disruption, and chronic inflammation. They will restore the connection between your brain and your muscle fibers, giving you back the power and stability that aging, or a sedentary lifestyle, has stolen. Your independence is your most valuable asset. Do not trade it for convenience or fear. The gentle warning I must give you is this: inactivity is a toxin. The single biggest predictor of health decline is not age, it is the amount of time you spend sitting. Start today. Pick 3 of these exercises to start with, and commit to them for 2 weeks. Remember Eleanor Vance, from nursing home preparation to mountain trails. That power is within you, too. If you found value in this evidence-based approach and want to continue the journey to living a healthy, independent life, please do 2 things. 1. Give this video a thumbs up so this message can reach more people like you. 2. Subscribe to the channel and hit the notification bell. In the next video, I will share the 3 crucial natural foods that act synergistically with these exercises to rapidly reduce the chronic inflammation that is shutting down your muscle-nerve connection. You do not want to miss it. Thank you for trusting me with your health. Now, go be strong.